Cancer in older adults, a physician's monologue. Our aging population presents a growing medical challenge. In the United States, about 60% of new cancer diagnoses and 70% of cancer deaths occur in adults aged 65 and older. This scenario isn't just about numbers, it's about human lives that can be transformed through up-to-date medical knowledge, early detection, and therapeutic approaches personalized for our seniors. The stark reality: we cannot ignore globally, 71% of cancer deaths occur in the elderly, while incidence increases dramatically with age, from 78 cases per 100,000 people aged 15 to 39 to a staggering 2,300 cases per 100,000 after age 75. The projection is even more challenging. By 2050, we expect 35 million new cancer cases globally, a 77% increase from 2022. In the US, older men have historically shown a higher cancer prevalence than women, with prostate, lung, and intestinal cancers leading the male statistics, while breast, skin, and intestinal cancers predominate among women. The most common foes: after 60, lung cancer, the leading silent killer. More than 80% of cases occur in people over 60, with a median age of diagnosis at 71. Smoking remains responsible for 85% of cases, but even ex-smokers maintain an elevated risk for decades. Early detection through low-dose computed tomography, LDCT, can reduce mortality by 20%, especially in individuals with a smoking history greater than 20 pack years. Breast cancer. It knows no age. Although often associated with younger women, the incidence is 1.7 times higher in women after age 65. Paradoxically, tumors in older women tend to be less aggressive, but delayed diagnosis remains a challenge. Mammography is still recommended until age 74, with individualized decisions based on a life expectancy of more than 10 years. Prostate cancer, a matter of time and vigilance. More than 50% of cases occur in men over 75, with a median diagnostic age of 68. The discussion about PSA screening should begin at age 50, but after 70, the benefit decreases significantly. The time to benefit for screening is 11.2 years, making life expectancy a crucial assessment factor. Colorectal cancer. Prevention is still the best medicine. Colonoscopy remains the gold standard for detection and prevention, as removing polyps can stop their progression to cancer. For seniors aged 75 to 85, decisions must be individualized, considering the time to benefit for screening is 10.3 years. Annual fecal immunochemical tests, FIT, offer a less invasive alternative for frail patients. Modern treatments, new hope for the golden years. Immunotherapy, revolutionizing treatment in seniors. Contrary to old biases, older adults respond similarly to younger patients to immune checkpoint inhibitors like pembrolizumab and nivolumab. 2024 studies with 216 patients showed similar efficacy across age groups, although older patients required more corticosteroid support, 34% versus 16.7%. CAR-T therapy also shows promise when adapted for this population. Targeted therapies, personalized therapeutic precision. Small molecules and monoclonal antibodies offer less toxic treatment than traditional chemotherapy. Drugs like trastuzumab deruxtecan for HER2+ tumors and repotrectinib for NTRK mutations provide oral administration and a more tolerable side effect profile, allowing for outpatient treatment while maintaining quality of life. Minimally invasive surgery, technology serving recovery. Laparoscopic and robotic surgery reduce surgical trauma, hospital stays, and complications. For seniors, this means a faster recovery, less need for analgesia, and an earlier return to daily activities, factors crucial for maintaining functional independence. The unique challenges of old age, the trifecta of complexity, comorbidities, frailty, and polypharmacy. 60 to 70% of older adults have concurrent cardiovascular diseases, while diabetes, kidney failure, and respiratory diseases complicate treatment. Polypharmacy, the use of 5 or more drugs, increases the risk of interactions from 13% with 2 medications to a staggering 82% with 7 or more. Frailty, a multidimensional geriatric syndrome characterized by reduced functional reserve, emerges as a more important predictor than chronological age. Tools like the G8 and CARG can identify vulnerable patients and help adjust treatments, reducing toxicity in up to 50% of cases. Geriatric assessment, the differentiator in care. The Comprehensive Geriatric Assessment, CGA, is revolutionizing geriatric oncology care by evaluating functional status, cognition, nutritional state, social support, and comorbidities. Studies prove that a CGA improves overall survival, reduces hospitalizations, and influences therapeutic decisions in 50% of cases. Invisible defenses, strengthening the immune system. Immunosenescence, understanding immune aging. Aging is not an inevitable decline for the immune system. Immunosenescence, the age-related process of immune dysfunction, involves thymic involution, loss of naive T cells, and an accumulation of memory T cells. Paradoxically, inflammaging, a chronic low-grade inflammation, also occurs, which can promote tumor growth. Scientifically proven protective strategies. Adapted physical activity is the most powerful intervention, reducing the risk of prostate cancer by 10 to 30% and mortality from breast cancer by 42%. 150-300 minutes of moderate activity per week combined with resistance exercises, combat chronic inflammation, and modulate protective hormones. An anti-inflammatory diet based on the Mediterranean pattern, rich in omega-3s and antioxidants, shows a 25% reduction in colorectal cancer risk. Vitamin D emerges as a crucial nutrient, with studies revealing an inverse association between serum levels and the incidence of multiple cancers. Quality sleep strengthens immune surveillance, while chronic deprivation increases cancer risk by up to 59%. Cognitive behavioral techniques for insomnia and proper sleep hygiene are fundamental for oncology patients. Social connections are not a luxury, but a medical necessity. Social support improves treatment adherence and reduces anxiety and depression, with 27% of older adults with cancer showing indicators of loneliness that negatively impact their quality of life. Scientific innovations, shaping the future. Revolutionary biomarkers, epigenetic clocks, based on DNA methylation, have achieved an accuracy of +3 years in determining biological age. In 2024, a global scientific competition involving 152 teams developed biomarkers capable of predicting mortality and therapeutic response with unprecedented accuracy. Precision medicine in geriatric oncology, genomic sequencing with a projected cost below $300 by the end of 2025, artificial intelligence integrating multimodal data, and analysis of the gut microbiome as a predictor of immunotherapy response represent the new frontier of geriatric oncology. Anti-aging therapies. Senolytics, drugs that eliminate senescent cells, are showing promising results in clinical trials. Combinations like trametinib plus rapamycin have increased longevity by 30% in animal models, with a projected market of $46.6 billion by 2033. Quality of life, the true goal, redefining priorities. Unlike younger patients, seniors often prioritize quality of life and maintaining independence over mere survival. Palliative care integrated from the time of diagnosis, not synonymous with end-of-life care, improves quality of life, reduces aggressive treatments, and decreases hospitalizations. A multidisciplinary approach. An integrated team involving oncology, geriatrics, palliative care, and psycho-oncology represents the modern standard of care. prehabilitation before treatment, and ongoing oncologic rehabilitation optimize functional outcomes and reduce toxicity. Empowerment through knowledge. Education on self-care and invisible defenses transforms patients into protagonists of their own recovery. Stress reduction techniques, cognitive stimulation, and family support are essential components of holistic treatment. Transformative conclusions. Cancer in the elderly is not an inevitable sentence of decline. Chronological age does not equal biological age, and the heterogeneity of the older population demands personalized approaches. Geriatric assessment tools, modern adapted treatments, and strategies to strengthen our invisible defenses allow us to not only extend life, but also preserve its quality and meaning. 3 crucial messages to share with our patients. First, aging increases risk, but early detection and proper treatment maintain an excellent prognosis. Second, a healthy lifestyle strengthens your natural defenses at any age. Third, modern treatments consider you as a whole person, not just the disease. The quiet revolution in geriatric oncology is happening now. Precision biomarkers, personalized therapies, and holistic approaches promise to transform cancer care for our growing senior population. The future of treatment lies not just in more potent drugs, but in wiser, more compassionate, and more effective care for every unique patient who seeks our help. This knowledge represents concrete hope. We can not only add years to life, but add life to the years of our older patients with cancer.